it seems Oracle mostly keeps me in the, how do you say, locked up in writing. So the abstract, I just thought, so we stay on topic a little bit what it's about, even though I'm going to bring up a lot of, to make this personal, it's how I'm using open source code, not necessarily, well, and that includes how's Oracle using open source code. But I'd like to pepper the discussion with what that means to open source in general, what it means to business models for those of you who are thinking about making businesses or are in business around open source, and particularly making the differentiation between what are the opportunities for small business in open source versus the big groups like Oracle. So a little, because not everybody here is native healthcare, just a little bit of healthcare is no different than any other industry. You have to reduce your cost, you have to deliver higher quality for lower cost, and you have to make sure you make a revenue while you do that. So that's been the same for healthcare ever since probably Greek times. The federal government has been pushing healthcare, electronic health records across now multiple administrations. You remember the Bush announcements and then the Obama announcements, and so I've got some current administration quotes, but no matter what happens with administrations, there'll be similar quotes, coming along. So that's our environment here. We're a little late to the game in the US compared to the UK, Canada, and some of the places that engaged, Netherlands, a lot of the different European countries engaged along these lines long before the US. So this is not just a US phenomenon, but it's really a global phenomenon. And so I work on a global business unit that fully intends to be working globally in this space. And in fact, that's where most of our activity is, since other countries were there first, from that perspective. Health information exchange, what is it? It really involves, people think about healthcare providers and they think about payers and then they kind of give up. Well, there's zillions of stakeholders in health. We just heard from David how many stakeholders there are among the federal government agencies. Well, think about how many state agencies now are stakeholders. Think about clinical research organizations and pharmas and HSSC and whatever you call HSSC, that's a research network, stakeholders in health information exchange. So it's a huge, huge space now, potentially. And the typical kind of maturity model that people have focused on is one, EMR is usually defined as a freestanding organizational electronic medical record. Then EHR was the next stage where people said, well, really we're talking about the whole health record for the patient, not just what one institution has in its EMR. So we renamed it EHR. And then health information exchange may be done, is anytime these stakeholders exchange data, but there's many ways to organize health information exchange, and some of these national exchanges like the US Nationwide Health Information Network is a kind of healthcare information exchange. And as I mentioned, whole countries are doing this now and they call it different things. It's the spine and the provincial blueprint in Canada, or the spines in UK, and then Singapore, I can't remember what they call it. But, so all these different nations are developing this model. In the US, this is the statement of the current administration. And notice that these are my highlights in terms of red, must be grounded a common foundation of standards, technical specifications, policies, and we could add open source to that. So the important thing is, I think, from this is to recognize it, and I think I mentioned that this morning, is that it's not simply open source. Even an open source with good governance and all of that, it's standards-based open source. It's open source that's testable inside a NIST certified testing laboratory. So, there's a lot more to open source in this vertical, health, than there is perhaps in open source in some other industries related to standards, and vendor testing. I know that vendor testing has been new to Oracle, as big as Oracle has been. Actual vendor testing is a new experience for Oracle. And so, oh my God, you mean we have to go get our stuff tested before we can sell it? Whew. That is a new thing. So, what does health information exchange mean to providers? Well, at the local level, we've been seeing these, what are called today enterprise HIEs, which means that the HIE is run by, if you look at where the governance comes from, it may be a big health system that reaches out into the community, but the governance is really the board of that health system. So it's one organization provides the governance. It's a private organization generally, even though it might be not usually nonprofit. And we call that enterprise HIE. Well, now you get up into the community where now you're, how do you say, it's not just one enterprise, it's, that's controlling it. Now it's a geographic area. And there's usually competitors now who's sitting on the board together. And that's a major difference. And then we're seeing the state level, the private multi-regional hospital chain enterprise, and you can think of that as the VA. You can think of it as the Mayo Clinic. You can think of it as HCA or many of these big chains. And then we get to the public national, but also people are proposing international health information exchange. And whereas that's somewhat obvious in places like Europe, where the countries are so small, the populations, there's so much mobility. We don't think about it as much in the US, but health information exchange for the purpose of tracking global diseases, of creating large populations of rare disease. There's many reasons to have international health information exchange, and I think more of that's coming. So when I bring up Oracle Health Information Exchange, that's what we call it. What I usually don't present on is open source and use. What is all the open source and that we're engaged in? First of all, health information exchange. There's some in the U.S. especially. There's kind of like 3 areas we like to focus on. One is you can't do health information exchange unless you have enough governance and compliance that providers and consumers have trust in what you're doing. If they don't trust what you're doing, then you failed. So, and in the U.S., you can actually go to jail if you don't have the right governance and compliance. So there's a little bit of a stick there as well, too, from that perspective. Meaningful use is a term that's come to mean we will give you subsidies, healthcare providers, if you use electronic medical records, not just buy them, but use them in a meaningful way. So I expect that term to be old-fashioned in about 3 or 4 more years. But today, it's part of the, the stick, or the bar that you have to jump over. Yeah, stick you hold out, or bar, to get your extra bonus payments. It's a kind of pay for performance. And then, but really the future of making healthcare more personal, consumer empowerment, personalized healthcare, not just in the sense of genomics and proteomics and some of those places where it's used, but truly in control of the consumer and patient-centric and all of those sorts of things is really the future of healthcare. From a social perspective, we hope. So I'm just going to kind of orient you to a couple of different product names and where how we use the term, and we're probably going to have to replace all this with Orion, or Orion, however we would, yeah, instead of Connect. But the issue is we, and we'll go over that. We have a product that currently has Connect at its core. Now, it's not, we call it the Health Sciences Information Gateway because we've already announced that Direct, another protocol, SMTP instead of web services, will be added to it. We expect in the future that other protocols that are necessary in healthcare will be added to this gateway. Why? Because the gateway is about privacy and security. It's not about what protocol are you using, at the time. We were just talking about, how many different protocols will the sophisticated small business need to support? For example, Jabber type protocols, et cetera. Now, we also use the term connect architecture because one of the very, very interesting things about Connect is the fact that it describes a specific edge server architecture that is not commonly understood. And so I'll talk a little bit about that. But it was important to us at Oracle was the sophisticated architecture that was brought forward as much as the code itself. So one of the ways I start out this is okay, this sophisticated architecture, what do we think it addresses? Well, what do big health enterprise CIOs, and I'm not talking about the small business here, but the big ones, the ones who run Epics and Cerners and all of that. One of their issues with health information exchange is how much do we let people we don't know from the internet come into the inside of our EHR? And how much protection has that EHR vendor created for this new kind of user who's coming in from the internet whom we don't know personally? So that's we've had a number of CIOs tell us, we really would prefer that health information exchange, queries and things didn't go into the middle of our electronic health record. So the other thing is, how do we control what information we want to share and what information we don't want to share? Is the EHR system giving us enough control over that shareability of information to meet our business needs, our concerns, our policies, et cetera? So, and then next, and the project here in South Carolina is very important to this, how can CIOs improve the granularity of control over the release of information over the internet? Because one of the reasons that, clinical research doesn't work very well today is because there's not enough granularity in release of information control over the internet to really create huge, or enroll patients into huge clinical trials. So it's very visionary that that's been a central part of the health science of South Carolina. So I'm getting more out of our relationship than you're getting from me.